guys, this is Dr. Hub. Today we are going to look at the conversion disorder. So conversion disorder is also known as the functional neurological symptom disorder. It is a functional neurological symptom disorder. So what are the common presenting symptoms of this? So the symptoms of the conversion disorder, it includes there is a weakness, there is presence of weakness, there is also the paralysis. There can be weakness, there can be paralysis. What else? There can be non-epileptic seizures. There can be non-epileptic seizures. And there can also be movement disorders. There can be movement disorders. Then there is a speech or visual impairment like mutism or blindness. There can be speech or there can be visual impairment. There can be speech or the visual impairment. And this includes there can be mutism. There can be mutism or the blindness. Next comes there can be some swallowing difficulty as well. So it can also include swallowing difficulty, and also the sensory disturbances, and also the cognitive symptoms. So weakness, paralysis, non-epileptic seizures, movement disorder, speech or visual impairment, swallowing difficulty, as well as sensory disturbance and cognitive symptoms. Then what about the diagnostic criteria? So if you look at the diagnostic criteria, it includes there are the symptoms of altered neurological functions. There's symptoms of the altered neurological functions. And this includes the voluntary, motor and sensory. So the voluntary, motor or the sensory. Next, it often precipitated by a physiological stressor. So it is precipitated by a stressor, and a temporal relationship between the stressor and the symptom is present. So there is a temporal relation. So this is between the stressor and the symptoms, between the stressor and the symptom. Next is there is it is not feigned or intentionally produced. It is not feigned or intentionally produced. So as in the factious disorders or malingering. So as in the factious disorder or in case of the malingering. Next is the finding is incompatible with a recognized neurological condition. This is incompatible. It is incompatible. This is with a recognized neurological condition. Next will be the symptom causes a significant social or occupational impairment. So it can cause a significant social or the occupational impairment. Next, we are going to look at some other important features. So the other important features it can include there is a primary gain. There is something known as a primary gain. Next is there is a unconscious relief from stress. There is a unconscious relief from stress as the focus of the patient shifts to the symptoms. So the focus of the patient shifts to the symptoms. Next will be something known as a secondary gain. So in terms of secondary gain, the attention gained by the patient as a result of the symptoms. So the attention is gained by the patient, and this is as a result of the symptoms. Then comes the labile indifference. The labile indifference. So this refers to the absence of the concern towards one's problem despite the severe disability. So there is an absence of concern towards one's own problems. So one's problems, and this happens despite severe disability. So despite the severe disability, this is happening. So despite severe disability. Next, we will look at the aesthesia abesia. So what is meant by the aesthesia abesia? So there is the aesthesia abesia. So aesthesia abesia is a wildly ataxic. It is wild. It is wildly ataxic. There is a staggering gait accompanied by irregular. There is a staggering gait. So the staggering gait is accompanied by, there is a irregular, there is a jerky truncal movement, as well as there's a thrashing and waving arm movements. There's a thrashing as well as waving arm movements. So how do you manage this condition? So management is by, there is a first line. So how do you manage the first line? Is by the education and the self-help techniques. So first is by education as well as the self-help techniques. So next we have the second line. So how do you do the second line? Is by the cognitive behavioral therapy. So the third management is by the physical therapy for the motor symptoms. There is the physical therapy. This is for the motor symptoms. So this was about the conversion disorder. To learn and grow daily like this, please do subscribe.